Hello everyone, I'm Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this video, or if you're listening to audio, one area that I wanted to focus on was autism spectrum disorder. And so evidence-based autism interventions are important, but in order to do so, it's important to identify any sort of social stigma and the beliefs of immigrant Mexican parents. So this was a mixed methods analysis and salient responses for ASD perceptions, which is autism spectrum disease perceptions, including specific characteristic about the child, that is loving, and perceptions about lack of resources. Responses of ASD, autism spectrum disorder, causes were vaccines, genetics, and a combination of genetics and environment. That's the response people give when they're asked about autism spectrum. Inductive analyses reveal distinct beliefs about social stigma, child characteristics, factors supporting development, and parents' emotional stress. I'll again go into evidence-based autism interventions and biomedical approaches to diagnosis and treatment often assume ASD to be natural biological phenomenon rather than contingent upon cultural beliefs or historical context. This presumption of a shared notion of empirical pathology can conceal the social, cultural, and linguistic components of ASD. Understanding how those factors shape access to diagnosis and treatment of ASD is necessary to enhance early learning opportunities. So, if we're looking at individualized education plans, these are especially important for autism spectrum disorder. So a lot of Hispanic parents, families may be undocumented and may decide not to search for access treatment for fear that they may be deported. Many times parents are expected to prove that their children need an early education program even before an insurance company will cover the service. So these are types of documentations people are unaware of. Some parents may be unable to articulate why their children need autism spectrum disease. So it seems like there's a lot of misunderstanding upon not only immigrant Mexican individuals, but also fear that they will be deported, which contributes to some of the difficulties within this subpopulation. So beliefs about autism spectrum have been shown to influence parents' treatment decisions. So one of the other aspects that's worth considering is the curandero, and the expectation that individuals may be cured from that, when in fact practitioners must acknowledge that parents' belief. So before we start trying to look at what is going on, giving it in the context that Mexican heritage parents would believe to use this Western medicine over curandero is important, because the cure is oftentimes thought to be done by curandero. So there's a need for shaping parents' understanding, implementation, and evaluation. So EAI is evidence-based interventions. So this goes through the research questions, primary aim, secondary aim, and then the theoretical framework, the critical sociocultural approach, which is from Wisner's 2002 study. The Holloway and Skinner talked about 2007 three fundamental elements of this framework. First, the professional field of autistic spectrum, which is a community of practice with specialized language practices and routines. So this goes through a quick article. There's 25 participants, and that's it. So there's not too much analysis to be done, but here's the percentages and the procedures. Thank you for listening.